আসসালামু আলাইকুম, ওয়েলকাম ব্যাক টু দ্য প্রোগ্রাম। সুধীমণ্ডলী, আমাদের সাথে এখন একজন নতুন গেস্ট এসেছেন, and I'm going to introduce you to our new guest who joined just now. And he is a well-known humanitarian activist who is the Deputy CEO of Muslim Aid. You may know that Muslim Aid is working around the world, and it is making a big impact for the poor and needy around the world. Not only outside the UK, I believe they are involved in some activities in UK as well. So I'm going to introduce you to Barrister Hamid Azad. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
How are you today?
Alhamdulillah,
All
not
right,
bad.
okay.
Thank you very much.
Mr. Azad, I'm going to start with you as you just came in. As I said to my introduction, that Muslim Aid is working around the world. What are the main activities? What, if in one sentence, if I would like to ask you, what do you do? Please.
If you ask me to say in one sentence, we solve.
No, the question was one sentence, but you can take time.
We serve
Yeah.
humanity anywhere. Yeah. We have a number of programs we
Okay.
are doing. Yeah. Like, of course, I hope you are familiar with Millennium Development Goals.
Yeah. That's the question I'm going to ask you.
We are signatory of Millennium Development Goals, and in fact, we are addressing all 8 Millennium Development Goals in different way. So among our programs, the pioneer programs are, we have education program.
Okay.
With education, we have a child education program, primary education program, formal education program, non-formal education program. We have shelter and construction program. We have poverty alleviation program, whereby we have interest-free microfinance program. We have health program, and reasonably very big health program. I think this is why Muslim Aid was interested for this program, and I am here. And especially I came here actually to say a big thank you on behalf of Muslim Aid donors, on behalf of trustees of Muslim Aid and staff, that what you are doing, it is very much in core of our heart, and it is one of the core program of Muslim Aid. And we have a shelter and construction program as well, and then we have capacity building program and advocacy program, awareness building program.
Can you
which
give
is
us an
part of
idea
the
how many
program.
countries you are working at the moment?
We are working in altogether
Yeah.
74 countries.
It's a massive
Yes, but we have field offices in 14 countries.
Okay.
Rest of the countries we are working with our partner organizations. Countries where we don't have our field offices,
Okay.
those countries we actually work with our partner organizations. So in that sense, you can say we have actually footprint in 74 countries.
Okay.
But with field offices, we are working in 14 countries.
Okay, thank you. I'm coming back to you again. And I would like to thank, on behalf of the guest and the viewers, that this program is being sponsored or brought to you, to the viewers, by Muslim Aid's generous help. Otherwise, it would not be able to come to you with these issues. And also, thanks to those guests, they kindly contributed their time, they volunteered their time, valuable times. So I thank you again for helping us generously to arrange this program. Before I come back to you again, Devi, you have been saying something before we went to break on the issues. What are the issues? For example, we have been talking about various services provided by Aid UK, that is befriending, carer relief service. Tell me, the economic climate, the downturn, does it in any way affected any of your services that you had to cut down the services?
Yeah, cool. I mean, the short answer is yes, and the long answer is also yes, because as I said earlier on, we are in a recession, like it or not. Local authorities have got savings to make, NHS PCTs have got savings to make. I think our responsibility as the voluntary sector is to actually make sure we make best value. That doesn't mean I'm going to do everything for free, because we've got staff to pay, volunteers need to be looked after. But we have to make sure we get best value for our money, which is why I've now got 3 Aid UKs, Hackney, New and Tower Hamlets, because we looked at our business model, our operating model, and said, well, actually, 1 Aid UK in each of the boroughs with 1 chief exec and 1 finance director is not sustainable in the long term.
It is.
So we've moved to the three-way model where one chief exec, one finance director across the three. And I think that that's right, because we get public money and we need to make sure that we use that public money wisely and get every single bit we can out of each pound.
My initial question was, what are the services, if you can name at least one, that you had to cut down because of the lack of funding or there's not resource available?
Yeah, we had to cut down our end-of-life care programme because
100%.
because there was less money available. Certainly the handy person team in Tower Hamlets, the hours, the guys who work on the project have been up and down all year.
Yes.
And they've been great. They've gone up in hours, they've gone down in hours, because there isn't the money there sometimes to fund it. Now, we've been quite lucky because we think that we're going to be getting a little bit more money, some of it from Muslim Aid, to actually increase the hours on that team. So, but yeah, it's difficult, and sometimes across a lot of areas there is only one way to actually run a service. Our home help service, for example, is only run because people buy it individually. But then you've got the move to personal budgets coming on, so people are going to have their own health budgets happening, and that's not great. Working in an area like Hackney, like Newham, like Tower Hamlets, that's not great because actually people have less money.
Yes, yes.
They're in somewhere in some of the wealthier areas, so it's a balancing act.
Yeah, it is. Voluntary sector as well as statutory sector are actually being squeezed. So how does it affect your services?
I think it does in a number of ways. One is that local people will no longer have as many services open to them, and particularly in the voluntary sector, but also in the statutory sector. And that means that when people say there are less organisations that are offering counselling for debt, as I said before, people are very worried about their housing benefits. So when the housing circumstances change, all of those have a knock-on effect on people who are already perhaps feeling very vulnerable and in need of support, and then those are the people then are going to be knocking on our doors.
Right, it is really difficult time, and difficult time needs serious decision. Mr. Azad, you have been touched on the issue of Millennium Development Goal. Can you elaborate a little bit and what it is involves and what is the plan?
I think the Millennium Development Goals, there are 8 goals set by the United Nations. Number 1 is eradicate poverty. Number 2 is achieve universal primary education.
Okay.
And number 3 is promote gender equality and empowering women. Number 4 is reduce child mortality.
Okay.
Number 5 is improve the maternal health.
Okay.
Number 6 is combat HIV, AIDS, malaria and other diseases. Number 7, ensure environment sustainability. And number 8, develop a global partnership for development. So all these Millennium Development Goals, I think it's around what you are actually discussing, because these maternal health, child poverty, HIV, AIDS, malaria, all these are actually linked with poverty, linked with education, linked with environment as well. So in nutshell, Millennium Development Goals actually develop a healthy, just and sustainable society and community. And this is what we are working for. As she mentioned a few minutes ago, we are working outside UK in 74 country, and at the same time we are working in UK as well. As she mentioned, we last year before last year, we very closely worked with Age Concern, and last year we worked with Age UK and Age Concern together. And our generous donors, mashallah, they contributed more than £30,000 to help thousands of elderly people in the UK. And we are looking forward to actually work this year in a
Your donors will be really happy to know that you have made partnership.
And this is, this is one of our brochure. It's actually dedicated for healthcare, healthcare and nutrition. Because I heard in your previous session, you are discussing about how important actually awareness,
Yes.
health awareness, how important it's actually taking care of their health. Yeah, people actually often neglect their health because they are not aware how important this is and how to take care of their health. What should be their food? What should be their
Lifestyle.
environment? What should be their lifestyle? That they don't know. So this is why we are trying to actually build awareness, especially in poor countries, in African countries like in Sudan itself. We have 19 clinics we are running, and it's free, almost free clinics. And in those clinics, apart from giving normal treatment, we are providing actually big awareness program. In Somalia, we have massive awareness building program around HIV/AIDS, malaria, and other program. In Bangladesh, in Dhaka, we have maternal hospital. The point you are discussing all these things, our people, our doctors are tackling all these things here. So in this way, Alhamdulillah, Muslim Aid is trying to actually develop really a sustainable society where people will have the education, people will have basic needs would be fulfilled, and where people will have the clear idea about how to take care of themselves and their environment and their children as well.
I'm sure the viewers who are watching you are speaking, they'll be really, really happy that Muslim Aid is making local partnership with Age UK and trying to help the people locally. I'm coming back to Dr. Liliana Rizzi. Would it be possible to give us a snapshot of the survival rate of lung cancer in various stages?
Well, lung cancer is quite complicated because you get different kinds of lung cancer. So it depends on what kind you get or what type will determine what your prognosis or what your outcome will be. So I think the principle of, in general, of lung cancer and any other cancers, that the earlier stages you're more likely to do better. And the reason why you're likely to do better is because in most early cancers you can use surgery, you can cut it out. Whereas the later it is, you're more likely to maybe need surgery plus another kind of medicine, which we usually call chemotherapy, or radiation therapy. So the treatment becomes more complicated. So I think, without getting into specific figures, which are maybe not that helpful, is that people with lung cancer tend to present late, even in more affluent areas, because cough may obscure an underlying cancer. So
what is the best way to detect earlier?
What I said earlier about cough, very important, is that a cough that lasts for more than 3 to 4 weeks, you need to go and see your doctor and just have a discussion about what could be going on.
Any particular type of cough, or whooping cough? Or?
Well, whooping cough is an infectious cough, and it's usually in children and not in adults.
Right.
And there's an immunization against that. Okay. It's called pertussis.
Right.
But I'm talking more generally to do with in adults, because cancers are more likely to occur in adults. You do get childhood cancers, but we're talking generally now about breast and lung cancer on this program. So it's more that you have a cough that lasts for a long time, or a cough that changes in some way. So as I mentioned earlier on, that people who smoke are more likely to have a cough anyway, but it's if their cough changes in some way. So those are the kinds of key things. I just want to go back to one step about survival with lung cancer, is that actually taking out a lobe or a section of the lung is quite complicated. And also in terms of how it may have spread in the body may become quite complicated. Because you must remember, when cancer spreads, it's small little cells that are starting to travel around the body. So catching it early is very, very important. But I want to just be very clear that in general, picking up something early is likely to have a better outcome.
Thank you.
Sorry, part of the stuff we're working on the Small T campaign is actually going out to community groups and doing awareness raising. So we're doing lots of community groups across Tower Hamlets. Hopefully we're going to be doing some in Hackney as well. And I think that's where it's important that we work with people where they are. So rather than saying, hey, everybody must come to this meeting to talk about lung cancer awareness, we want to go out to the community group. So if there's a group that meet together for lunch or for some sort of social event, we go to those groups.
Liliana was saying that it's usually on the adult are usually being suffered by cancer. I believe you had a project called involving older people. Is there any chance that it can be, you can do some awareness
We'll go to
program.
We'll go to any group. Actually, I have to say, and yes, across Hackney, Newham, and in Tower Hamlets, we do run user involvement programs, which is about getting older people to actually have their say on how services should be run, be it NHS, be it housing, be it any sort of statutory service. So, well, I think what we can't be is complacent and say, well, because we've got a user involvement group, therefore that's who we'll consult. We have to go out to older people across all the communities. So let's face it, we're talking about Hackney, Newham and Tower Hamlets. We are talking very, very diverse communities with different needs, with different spiritualities, different faiths, different gender politics. So we have to go out to all those groups. And one of you callers earlier sort of pointed out properly that, if it's a women's group, we're not going to send men in to talk about breast cancer. Equally, if it's a men's group, I'm not going to send a woman in to talk about prostate cancer. It's about making sure the person who's got the message...
It's a culturally sensitive service.
It's the right person. It's the right person. It's somebody who can ensure that people are happy to listen and get their say. We've got to send the right person out, and we do that.
Having said that, what Devi has said, I'd like to draw your attention. Say you removed a lump. There is a physical side of operation, but there is a psychological and mental or emotional side as well. How could you fit in the chaplaincy from the religious or spiritual viewpoint? Does it help to involve in the after operation care? A chaplain can come and speak to them. They can have some sort of a strength to fight the disease or recuperating. That sort of. What is your?
Well, I think that it, as Debbie was saying earlier, it depends on the person and their family. But if you are somebody who is religious and that's important to your community, and maybe you're Muslim, then of course it will feel natural and normal.
But chaplaincy is Christianity as well, Muslim as well, Judaism as well. All of them are.
And it can, I think a spiritual or religious life can, for a lot of people, offers them a great deal that really helps them psychologically. And actually, we've started to do more and more work with mosques, and imams are now much more interested in mental health, in helping people give up smoking, and to recognise that how important that is to a lot of people, but without forcing it on.
Thank you. I would like Mr. Azad's contribution here. Do you think these services will greatly help the target community or the patients if chaplaincy is made more available during the planning or after clinical services being provided? What is your say on this?
Thank you very much for this question. Actually, I had the opportunity to run this sort of program. This is a project I myself actually run in a bigger way. It's actually European Commission funded project, which we call Faith Initiating Regeneration. And under this program, actually train hundreds of imams, and we trained a number of bishops and other religious leaders, and we trained lots of community leaders as well, and we provided awareness building program, training program, capacity program, building program to different mosques, pagoda, churches, and different community organizations. And the result is the area where we actually trained those organizations, and when the mosque or church or community organization got involved, within a year we saw a big change in the community in all these respects what you are talking about. They came out, and then in fact they wake up. They work up about their health, they work up about their education, they work up about their culture, about their habit, and many people actually in UK, and if I bring actually example from outside UK, like last year I think in Bangladesh, through our this awareness building program, 700,000 people actually got rid of smoking.
Okay, I have to come back to you, Mr. Azad, because we are running very short. We have last 1 minute and one last sentence from you. What would you like to say about to the viewers?
I think the most important thing is something to do with confidence. For all of us to give the message of the importance of confidence that you can look after your own health. I think especially for women who are so often carers.
Thank you. Devi, what the last sentence?
I think I'd say exactly the same. I think we've all got responsibilities as individuals to do our best for ourselves, our families, our friends, our wider community. There is help out there. There is people who want to support you to do that. So let's support it together.
Thank you. Dr. Liliana.
I think it's about one life that we have and to live it well, and by that it's being healthy, and healthy inside of yourself, which is exercise, fresh air, lots of vegetables and fruit. These are the simple things that make one strong and able to deal with difficulty.
Yeah, Mr. Azad, final word.
First of all, thank you very much for this program. Second, I would ask a community, especially community, to wake up and come together and to get together to serve the humanity around what we discussed today. Thank you very much.
Thank you, my guests, for coming here. Thank you, Muslim Aid, and thank you, viewers, for being with us over the last 1 hour almost. And we hope to come back to you in the future with more deserving issues that needed to be discussed. And thank you again. Assalamu alaikum wa rahmatullah.